Well, happy Monday, everyone, and welcome to my show where it really is okay to not be okay. I'm Rae Bonney, a qualified counsellor, workplace mental health specialist, not to mention a very dedicated and oftentimes enthusiastically disruptive men's issues advocate. Not every girl's dream job, but hey, remember, men also matter. As always, I'm unwrapping one of the greatest gifts going around, and that is people. Layer by layer, we explore the thoughts, experiences, achievements and challenges of ordinary people bound to inspire the best you, and at the same time acknowledging that it really is okay to not be okay. Now, wrapping up the first week of May today, and there is actually nothing terribly significant to report for a change. No public holidays, no kids going back to school, no Commonwealth Games. I think it's a bit of a long haul through the cold weather till the next public holiday. I think that's in June. So if you do want to hear about my weekend, well, I did spend around 20 hours in the delightful town of Deloraine, which sits almost smack bang between Devonport and Launceston in Tasmania. And not only did I have the amazing privilege of addressing the Deloraine Kangaroos Football Club around what it feels like being them, but I also stayed in my ancestors' dwelling, the Bonnie's Inn. It was built somewhere in the 1820s, and wow, it was quite a treat. I flew back yesterday to speak to the hordes of people attending the Man Cave Expo at the Melbourne Showgrounds. So all up, I had a very engaging weekend talking about men's issues. Now, it is no secret that nurses and midwives can often neglect and sacrifice their own health and well-being for the sake of others. And whilst this is a commendable characteristic, it's important to recognise that in order to support others, their self-care is critical. The Nursing and Midwifery Health Program in Victoria was established to provide advice, support and case management to nurses, midwives and their students of nursing. Initially, they addressed challenges presented by substance use and then later associated mental health concerns. Glenn Taylor, a registered nurse and CEO of NMHP Victoria, he's with me today to talk about the many challenges facing this extraordinary helping profession. Welcome to the show, Glenn.
Good afternoon, Rae. Thanks for having me.
I do like a big build-up.
It certainly was a great build-up.
It does. It tends to take half of the show and leave you not much space. Now, we've known each other for quite some time.
We have. I think we first met through Beyond Blue. I don't remember exactly when or how, but I remember you stuck in my mind. We tried to catch up back then, but it just sort of didn't work. And I've learnt this morning before we went to air why, because you've got so much going on, as have I.
That's right. We're people that get out there and do stuff, which is why we did connect at Beyond Blue. And I did some research through my email logs and discovered it was about 4 years ago that we had our first conversation. And it was when I was working on the Heads Up program for Beyond Blue, which is the online resource that we created for Australian workplaces to help manage their mental health. And you were particularly interested given the nature of your business. And that's where the conversation started. We never met.
No, it didn't come along until
we bumped
into each other just recently.
We tried. There were many occasions where we'd booked an appointment and then failed to turn up or whatever that may be. And then we were at an insurance industry event this year. Of all things, yes. And I sort of went along thinking I might have a couple of wines and a snooze. Insurance. And who was sitting next to me but you?
Meant to happen. I believe in these things meaning to happen.
Yeah, so here you are on my radio show. Now, the Nursing and Midwifery Health Program in Victoria. Number one question is, why is this just in Victoria?
The short answer is that it's really come from the hearts and minds of some really key people in the industry who saw that there was a need for it, and it grew from there. It's a long story as to why it hasn't gone. This particular case management face-to-face model hasn't gone national, which we don't have time for. But essentially, it was a brainchild of some key people in the area. There was a doctor's health program. There still is a doctor's health program in Victoria, and it was really there was a call through the doctor's health program for support for nurses and midwives, and the the nurses of the day and the union, the ANMF, the state government got on board, and also the regulator, the Nurses Board of Victoria at the time, and made it happen. It just made it happen. It was a fantastic initiative where there was an obvious need. The research said there was an obvious need. The anecdotal evidence said there was an obvious need, and people just got together and made it happen.
Yes.
And that's what happens in Victoria. You know, these things are happening.
I do a bit of research before the show. When I say a bit, it is a bit in between flights. But I did read that in Victoria alone, we have about more than 93,000 nurses here. And I was curious also about the distinction between nurses and midwives. Aren't they the same thing? I mean, nursing covers a whole gamut of specialisation, and I would have thought one of those would be midwifery. So why do you segment that out?
That's a great question, and it's an answer a question that I had answered very clearly, very quickly in my tenure.
I thought you were going to say you didn't know.
No, it's actually there's a clear distinction between nursing and midwifery, and I wouldn't give it justice if I was trying to, I'm not a midwife, but to try to explain midwifery from a midwife's perspective. But it's the role that nurses play and the role that midwives play, and there's two separate registrations, and there's two separate lots of training. And of course there are nurses who are midwives and midwives who are nurses, but it is possible to be a midwife alone.
Okay.
And there's a whole range of different sort of views around that, which I probably would be stepping into dangerous territory if I went to try and explain. But the thing was that when the organisation was started, we were the Victorian Nurses Health Program. And then in order of recognition that midwives essentially do a lot of similar work and have the same issues that nurses have, that's when we broadened out the title, and we changed the title to Nursing and Midwifery Health Program Victoria. Okay.
Does that get any sort of negative feedback, that title, for the organisation?
No. In fact, the feedback we've had was been positive largely, and it's been from midwives recognising that midwives are a critical part of our world, and I also think there's also something around the connotation with nursing is that there's illness, and the connotation, and this is really basic, so forgive me the midwives who are listening, but the connotations for midwifery, it's around health, it's about birth and life. Yes. That's right. So that's my really sort of basic explanation.
Yeah, well, it makes sense when you describe it like that, because they are probably two different focuses, although both can contain similarities as well.
That's right, and we see there's many more nurses than midwives in Victoria, but we see a fair proportion.
Do you want me to tell you how many? Because I do have the stats. Well, you have non-practicing enrolled, you have registered, so there's a few divisions there, but nurse and midwife, so they combine those two. In Victoria, 7,305. Okay. New South Wales just pips us at 7,500. But you look through the states and ACT 500. So, yes. But you know, it's not difficult to say. I'm looking at the stats here that general nurses here in Australia account for 351,000 people who go out there and care for others.
That's astronomical.
Yeah, and anyone that's ever been recipient of nursing care, whether it's in a hospital or at home, you know, it'd be very difficult to not take your hat off to some of the things or many of the things that, you know, nurses are exposed to.
Indeed. And I think that I always had a great understanding of what nurses did and an appreciation for nurses being one myself.
Well, you're a nurse yourself, yeah.
But it wasn't until I started in this job and I needed healthcare, or my family needed healthcare, that I actually looked at nurses in a different light.
Oh, okay.
And being a recipient, when you're at your most vulnerable, having someone who has got the training, the expertise, the experience to do the work, and they take on, it's no questions asked. They take on what they've got to do and they deliver, and they do it largely with a smile on their face, with dignity, with integrity, and they do it in spite of who they're looking after, the circumstances that are taking place in their own lives. The people that we deal with in our service are often dealing with a multitude of issues outside of the workplace. And yes, we expect them to be as close to 100% as possible when they turn up at 7 a.m. or 10 p.m. To do that work. And as a recipient of care, to be honest, they don't really think too much sometimes, I don't think, about these people, they want the service they deserve and they're rightly entitled to. But we just have to keep in mind that these people are people first. And they have all the sorts of issues that we all experience, everything from relationship challenges, mental health concerns, alcohol and drug issues, financial problems, all sorts of things that they have to encounter, they have to deal with, and then they have to go to work and do, I think, the most important job in healthcare.
And put you first every single time.
Correct.
Give you that feeling of being cared for.
Correct.
And I think if people recognise that giving that care back can probably inspire somebody to give you greater care, well, then that just works, doesn't it?
That's right. And a recognition, a thank you, acknowledging someone who's looked after you, just saying thank you, that can make a nurse or a midwife's day, more than a pay rise or different conditions, which are very important also. But for someone to acknowledge the work that you did, and that flies in the face of what's happening in some areas where occupational violence is really challenging our workforce, and it's challenging the people who are making the decisions to try and make this a safer place to work.
Yeah, well, that's another whole show as well, isn't it?
It is.
But that's something to acknowledge, though. Just how do we keep, people who are in the helping profession safe? Because, it extends a lot further than just nurses.
It does.
Who people who are first responders as well to any incident can involve unexpected violence or, people that aren't, in their right mind and behaving in a way that's not conducive to anyone's health and well-being.
Correct. And we all have our own limits. Some of us have got a greater capacity than others.
Yeah.
But it's very important that we're aware of our own limitations so that we stop short of expiring that.
Yeah.
Because we all need to recharge on a daily basis to ensure that we're the best person we can be, not least of which a best professional as well.
Well, speaking of the best person, you are my best person because you're my very special guest here today. Let's backtrack a little bit because you fell into nursing. Accidentally, you told me.
I did.
So what did you want to be when you were a little boy?
Well, there was only, this sounds a little bit narrow, but it was only sort of a couple of professions, and that was sort of teaching or the police force.
Because you grew up in Western Sydney?
Sydney. That's right, yeah. And my dad was a house painter, and he was very clear that I wasn't going to be a house painter, and I needed to get an education.
Was it clear to you that you didn't want to be a house painter?
It's very clear. And so that sort of spurred me along to get an education. But I was very sports minded, and I was one of, like most a lot of adolescent males. I wasn't particularly focused on my studies, and I let that lapse. I completed my HSC, VCE at the time, but completed it. I was a incredibly successful failure at that.
Yes.
And it was fortunate. It was in New South Wales in Sydney, so it was the first year that nursing had gone into tertiary education on that scale up there. So I changed my preferences, and I managed to slip into nursing into university. It was the first university intake up there.
Right, and how old were you then?
I was 18. So I knew nothing about everything. I thought I knew everything about everything, but of course,
that's your
nothing.
job at that age.
And so I learnt pretty quickly that.
So it was a choice of convenience.
It was about getting into the system. It was about getting into the tertiary system, and I had never considered nursing. And I thought, that sounds okay. I'll give it a try, and I might try it for a year and then see if something else presents itself. But I quickly realised that's what I wanted to do. And it wasn't
do you remember the moment? Because I know many people who've had very enthusiastic forays into nursing and quickly worked out it was not for them at all, even though caring people, a good thirst for knowledge in the space, but the actual hands-on nursing was way out of their comfort zone.
Well, my very first placement, probably if I had a different approach, would have just turned me off forever, because it was working in very institutionalised location in Sydney with people with developmental disability who couldn't be really cared for outside of there, and there was a lot of really extreme behaviours. But I was somehow attracted to that, and I soon realised that there was this thing called mental health.
I was going to say, is that another term for a mental health environment?
Well, back in the time, it was more about developmental disability. So we're about people who couldn't be handled safely in their own homes by sometimes their ageing parents.
So people with schizophrenia maybe, or extreme...
extreme behavioural, but
Yeah.
so it was different to that. So it was
Okay.
people who had were born with developmental issues, who were
Yes.
unable to do mainstream mainstream schooling,
Yes.
and they were treated. We've got a lot to learn from back in those days, but they weren't treated as best as they could have been. And some people there was violence involved, and there was
Could this be people who are on the spectrum for autism, perhaps?
yeah,
Mhm.
and beyond, yeah.
Yeah.
Yeah, so that was my first foray into that, my placement, and that was after about 3 weeks. So I'd come from school straight into that, and that was it was shocking, but it was somehow interesting. And then I learned about mental health, and that you could be a mental health nurse. And it, on a very basic thought, I thought, well, what a good thing to be. You can get paid to listen to people.
You would have
and
been
to
the
help
only
people.
kid in the class that put your hand up for that one.
Well, probably was. Yeah, there was a group of 104, I think, that graduated. And there was only a handful of males, probably 6 males, and I think I might have been the only guy that went into mental health nursing. But
Wow. That's still quite a lot for that time, though, isn't it? Like how many?
late 80s,
yes.
late 80s. Yeah, well, that was 1 year. That was 1 year's graduation, and I think we started off with about 3 times that. So there was a lot of people who stepped down throughout certainly the first year, and then into the second and third.
Yeah. So then, during your placement time, I imagine you got to see a range of different settings. Which one appealed to you the most, even though you're talking about the mental health space?
Oh, look, definitely what they call just the acute mental health concerns. So people who are coming in their most disordered, the most impaired. People who have got thought disorders and who've got schizophrenia and have got significant mental health concerns, and just to have the capacity to be able to support them. I felt that I was essentially I was okay. My life was pretty okay, and that it made me grateful for my own mental health, even though in retrospect I had some challenges, which we probably all do. But just to have the privilege to work with people who needed your help, and then to see them improve, that was the thing that was really quite pleasing about it.
We've touched on something that's pretty important and significant in a lot of the stuff we broadcast out of this show, and that is stigma. And how would you describe, Glenn, what you've just illustrated here is that your high empathy for people, doesn't matter what package they come in, and removing those stereotypes and, I guess, unconscious bias to allow you to care for a person rather than their condition or whatever they're presenting. What would you say to other people about how we approach others that aren't behaving in a way that we feel is conducive to health and safety?
Well, I think judgment and stigma are a couple of things which are horrible in our society. I think that we're very quick to do that. We're very quick to judge, and certainly I was probably in that category when I was younger. One of the benefits I think about being in healthcare all of my professional life is that I've had the fortune to be able to see people who have been at their worst, and to appreciate that certainly no one I've ever met in the last 10 years working at the NMHP set out to come and meet us. We all take a turn sometimes we don't see coming, and we end up in strife. So I think it's really as simple about it as sort of walking in someone else's shoes. Can you actually for a moment stop and imagine what it might be like to be someone who's experienced a significant mental health concern or circumstantial problems, domestic problems, sort of things that we often don't have control over. Now, I'm not saying that there's certain things which we can't accept in our society, but I think the thing you're talking about is really just about people who have health concerns or health issues. For example, if you're a diabetic, and I knew that that's not going to have any impact on if I was employing someone with diabetes. But unfortunately, some people, their mental health concerns do get in the way of their capacity to get employment. And I think that we've still got a long way to go. I think we've actually made inroads in relation, particularly mental health, and probably around the work
in
that's
some
been
organisations, definitely. In others, not even.
You would know better than I about that.
Yes.
Yeah. But I think that we've come a long way, but we've still got a long way to go, because the problem is, and this is where our organisation comes to the fore, and the reason that it exists is around the fear of being identified as someone who's got a sensitive health condition.
Yes.
And the reality is the statistics are there. They're there to see that it's prevalent. There's a high prevalence around mental health concerns and substance use in our society, and nurses and midwives are no different.
Well, that's right. And given the lack of support and care that nurses and midwives get in general, I guess midwives might get a little bit more just vicariously because of the work that they do and the environments that they sit in. But general nursing, and I know a number that, you know, the thing to do is go out and drink with your buddies after work. That's where the support comes, is that collegiate piece. And that's not always, you know, good for getting up in the morning or being really agile.
No, it's not. And it can be done for a short period of time, and potentially when you're a lot younger in your career.
Okay. Bulletproof. Yeah.
But you're right. It's the fear that's associated with dropping your guard for a moment and saying to someone who might be in a position of authority to you is, I'm really struggling.
Yes.
And to know that they're not going to be judged or be put in a position where their employment might be at risk or their registration might be at risk. Because in our experience, the vast majority of nurses and midwives out there with these sorts of conditions, we're not talking about people who aren't safe to work. Most of them are. We're talking about people who, if they don't see there's an avenue to ask for support, they'll deal with it themselves. And often that's the worst thing you can do.
And mask as well, what's going on. And if anyone came to me, Glenn, and said, should I disclose my mental health condition to my employer? I'd 9 times out of 10 say no, don't, because you will be judged and you'll be discriminated against. And if you look at the helping profession and the expectation of performance at all costs and deliver a duty of care to people over and above expectation, to disclose that you might have a challenge, I don't think is acceptable. I mean, I think it is acceptable, but I think to the audience, it's not yet. We're not there yet.
It's a high risk.
Yeah.
And the expectation is a really good point you've raised. The expectation is multiple. There's expectation from the public. So as soon as they walk through that door, they're expecting high standard of care, which they should. But there's the expectation from the colleagues, the families of the people who you're supporting, but the colleagues, the organisation, the government, the department. But there's also internal expectation of each of us. And we for a long time have been quite regimented in the way that, you know, I've come through the system and you're going to come through the system. And I think that with millennials coming through now, they're starting to challenge the way we treat each other. And I think it's a good thing. I think that because the millennials are the future, and we have to make sure that certainly when you and I are a couple of decades on, we're going to want people who are well and fit, and the numbers who are trained and experienced in looking after us. And that's certainly what our focus is. It's about reducing the stigma, and it's about trying to ensure that people can get the support that they require with as least intervention as possible, so they can go about their lives and their work.
Do you think the approach to men in your industry is different to women, given that, I mean, there's probably about 3 questions in there. Number 1, is there a trend that more males are coming in? And then how are they managed differently than females?
It's probably hard for me to say, but personally, my own experience, I feel as though being a male was a benefit. Working in an acute mental health facility as a male, there's often, was it an expectation? Probably was a demand request. Yes, it was, that you be there to meet the divvy van at the back, and that you and the other guys other men who were working in the other acute wards around you would be there with the police to drag this acutely psychotic, often young, often big man out of the divvy van, and then that's when you would start. So
you're more equipped as a man.
Well, that was the expectation of the day. I've never felt being male.
I'm biting my lip here, Glenn. I would have a lot to say about that.
I'm sure you would. We're talking sort of almost 3 decades ago. So.
I'm sure it's still the case now. You know, best man for the job would be you.
Well, it was around the physicality of the nurses who were around, and I think that, and in fairness, if I'm honest about it, there was a sense of trying to take on a bit of responsibility for that, because you didn't want someone else to get hurt.
But it biologically makes sense that the bigger and stronger and more capable person would attend to something like that.
It does.
And typically that will be a man. Shock, horror, all you feminists out there.
But but I can't say that being a male has been a disadvantage. In fact, I think I've had a pretty good career. I've enjoyed.
Is that because of the setting that you're working in, though? And I'm not trying to dig any dirt here, but there has been some chatter amongst my people around the trend of males, particularly in helping professions, aren't signing up as much now because the world is saying that men are vulnerable to litigation around inappropriate behaviour towards others. So, and nursing requires a high degree of tactile behaviour. You know where I'm going with this.
It does, yeah. And, I hadn't really given the nursing thing much of a thought in relation to what's been happening around the world for the last 12 months or so. But I always take the view that, I can't really answer that question in terms of whether men are coming into the profession. I just
like saying it so people will listen and think about it.
But look, it is. But I think my view is I have sort of had this thing. Would I, if I was in a room by myself and my grandmother was looking down on me, would I be proud of what I'm doing, or would I be comfortable with her seeing that?
Well, that depends who your grandmother is, isn't it? My auntie Betty, who lives in Seymour, she's 83 years old, God bless her. Yes, if she was watching me, I pretty much got open slather on anything.
You know where I'm going with that, though. Yeah. So it's about standards and expectation of the profession, of the people you're looking after, of the regulator, of the government, because we've got a privileged position where there's generally always a position of power.
Yes.
So if I'm a care provider and I'm looking after someone who's ill and vulnerable, then I've got to. I want to know that I'm protected, and I'm not going to put myself at risk either.
Well, okay, we'll take all of that, and that's all well and good when you're fit and healthy and agile and you're thinking straight and clearly, but you put a mental health challenge in that mix, and then you put a lot of pressure on that, and it's been described in many environments in the medical profession can be quite fraught. Lots of pressure, people not behaving well. So you add all those things on. And then, of course, your exterior world, which there's stuff going on there. A lot of that can then become distorted, can't it? And you're not able to deliver the expectations.
Correct. I've met plenty of good people in my work, really, really good people who've made really bad and really dumb decisions based on...
In a moment.
What was and it's potentially changed their lives and their careers because of that decision. And we're talking about some quite significant things.
Yes.
Some minor things relatively, but certainly some significant things which can have an impact has a ripple effect on them, their families, their communities, but then also the work environment, so the department they're working in, the reputations, the culture. So all of these things can have a massive spin-off. But I think what you're alluding to is that we can prevent that from happening if we can provide supportive environments where there's always going to be pressure, but if we can look out for one another. The Heads Up program, I know, is a great
very good
initiative.
It's grown legs and arms, and there's not a lot of workplaces I go into now that have not heard at least about Heads Up.
Yep.
So that's a positive thing, but you're talking about supporting each other, and that's all well and good, but I think about risk management. How do you manage the risk? And the risk is in organisations is people. Typically we talk about risk, risk to finance, risk to, capital equipment, whatever that might be, but your risk actually sits with your people. And if you're not taking care of them and you're not creating environments of flourishing and ability to do a great job, then that will fail.
Yeah, that's always the risk.
And then we turn around and we apply things like performance management or, exiting somebody out of the role, which, what happens then.
Yes. And I think that if we can take that sort of upstream approach to be able to set things in place to prevent that from happening, then we're always going to be in a better position. But unfortunately, anywhere where there's humans, you're right.
Yes.
There's the potential for things to break down, and that's just the reality. So I suppose we're from a risk management position. Organisations are always trying to mitigate that risk by looking at setting things in place which can prevent that. But there'll always be people who won't be able to take that on or won't know about it, or they won't be in a position cognitively to be able to work through that.
Oh, absolutely. And that could be for a moment or it could be an extended period of time. But thank goodness for, your kind of small organisation. Tell me, Glenn, what is your opinion on this? Because I do a lot of social experimentation and collection of data. One of those is around the flu shot. And I know Ken's in there going, oh no, everyone should get the flu shot, blah, blah, blah. I don't know anyone that gets the flu shot that doesn't immediately get the flu or signs of the flu.
I've probably had it maybe the shot 3 times over the last 10 years, and
Yes.
I've never got the flu with or without it.
Oh, right, okay. Maybe they
So-
were just injecting you with placebo because
Perhaps.
they try and save a bit of money in the health sector. You know.
No, I'd like to think that we're ahead of it here, and that certainly wouldn't be the case.
But it's great to have you back, and we were just reflecting in the break that, wow, we could just talk forever because we're almost at wrap-up stage at now 43 minutes past 12 on a Monday. So where are you off to after this?
I'm going to a meeting with a participant, which is a nurse who
Yep.
is having a workplace meeting.
Yes.
So I'll be there in support of that person.
Fantastic. Well, that's a really good entree back into what it is you guys actually do. We've had a bit of a skirt around the industry, what the challenges are, what it might look like, feel like, and sound like. But you guys, as this little organisation, which you took the reins 2 years into its...
2 years after it was started,
Yeah.
that's right.
Yeah, tell us about that.
Yeah, so it's basically what it is. It just provides what we call a safe entry point into the service system. So nurses, and being one myself, we're fairly cynical about the confidentiality of our information sometimes, and we've all been privy to sitting around and listening to each other gossip about people's woes and private lives, which isn't helpful. But that can actually deter people who actually need the support for around their sensitive, what we call sensitive health concerns, from speaking up and asking for help. So the research was saying that if you were someone who had an issue with substances or your mental health concerns, then you were less likely to reach out and ask for help because you were fearful of being stigmatised or losing your job or
Vial of
losing your
morphine's gone missing, that must be you.
It must be you, exactly.
Yeah.
So it's about providing a safe place, a very safe place where people aren't judged, where our colleagues aren't judged. And it's simply a matter, there's no complex way of getting in, it's just picking up a telephone or getting online and sending us an email.
So that's what you guys provide, is confidential services that preserve dignity, preserve pride, and enable people to flourish more.
Correct.
Than... Because face it, if you did disclose in your workplace, especially in healthcare, that you had a substance abuse issue or were experiencing something, do you really think you'd be viewed favourably?
I can honestly say that that's improving, and there are a lot of great people out there, managers out there, who and middle managers out there who do take a sensitive approach to this, and who can and will support the individual to get the support they need. The balance that they need to do then is to ensure that the public, well, firstly, that if there's anything that's been done which is outside or breaches the regulations, then that unfortunately or fortunately needs to go to the regulator. But then you don't have to lose your job. You can actually be supported, treated, and even go through the regulator and keep your job. So there's people out there that are doing this stuff, and they're advocating like we do. Managers out there, decision makers out there, who are saying, we know that people have got flaws. We know that we've got employees who will be experiencing these things. How can we get them the help they need, tick the regulation box, and also keep them in the workforce? Because often they've got years or decades of experience and knowledge, and they're often really, really good operators.
Yeah, and going through a situational crisis, which
Correct.
momentarily, knocks you down or disables you for a period of time.
That's
until
right.
you're going to resume at the same level.
That's right.
So what, for people that are listening in that are nurses, no nurses, or people within the profession, how and why should they get in contact with you, and what would they expect?
Simply a matter of giving us a call on 9415 7551.
Glenn will pick up the phone, but not right now because he's on the radio.
Or they can get onto our website. And the why that's really
Yes.
important is that you, if there's any sense that things aren't great, then you just check it out, because just making the call isn't going to make it worse. So it might be that there's some information or some
But
advice.
who will they speak to? Do you have trained people like a call centre or?
No, it's actually there's only three of us that work, three clinicians that work there permanently, and our office manager Julie.
Yes.
And then we've got a very small pool of 3 casual nurses.
Okay.
So if they call, they'll be speaking to a nurse.
Yep.
And that was one of the pillars of the program, is that it needed to be a nurse-designed, nurse-led, nurse-run program, so that you as a nurse or midwife with an issue, you can call and you know that you're going to be speaking to someone who understands your profession, and you don't have to go through all the complexity of the jargon. And we understand what it's like to be in those circumstances, and we also have the experience in supporting people going through those things. And the other thing I haven't mentioned too, Rae, is that on top of the 90-odd thousand you mentioned, we also support potentially students of nursing and midwifery around the state as well. And that's, I don't know how many hundreds or thousands of that is, but so and they're a very vulnerable group.
Oh yeah.
Who undertake high pressure studies, and they're trying to balance life and families and part-time jobs while they're studying. So we do feel it's very important for them to know that we're there for them too, and it's free.
Yeah, well, one of my friends, Sam, her daughter Emily is currently studying to be a nurse, and she's currently working in the burns unit at, I can't remember which hospital. And it seems like Emily is a bit of a natural because nothing really perturbs her, but working in the burns unit has been really, really confronting for her. And, fortunately she's got an extremely supportive family where she can go home and unpack what it feels like being her. But not everyone has that, do they? So your service for these students, or the contingent of students that you're talking about, it's really important that these kids are being vicariously traumatised when they're seeing things for the first time. I imagine you can probably speak confidently about getting used to seeing things that aren't typical in your day, but
it's very true. It's very true. And some people don't have anybody to talk to, so that's where we can come into it. But some people do, but they don't feel that they can continually go back to the well and burden them. So that's where we can come into our own, is that our families are, they're there to support us, but you want to do family things with them. And whilst it might be a couple of minutes a day or a week that they can talk about something that's been traumatizing, I think a lot of the people we see, they want to make that separation. So they might have someone they can talk to, but they prefer to dump it on us, which is fine. That's what we're there for. And we know how to process that, and we know how to look after ourselves in the process of that too.
So then are you membership based then?
No, the only qualification that you need to access our service is to be either studying nursing or midwifery, or to be a nurse or a midwife, and you don't have to be practicing even. And we also support managers and HR departments.
But if you're in a moment of distress and ring up, do you have to first go through the vetting system of do you qualify for this conversation?
No.
Okay.
No. We like to be, when it was established, it was about how can we rule people in and reduce barriers, not rule people out and make them jump through hoops. So we don't ask for any registration details or any identification details, at least in the first instance, because often it's taken someone weeks or even months to pick up the phone, to get the courage to pick up the phone and say, I need help.
Yes.
So we have an expectation in our team that if you've got the courage to pick up the phone, then when we pick up the phone, we'll greet you with dignity and respect, and we won't make you jump through too many hoops initially.
Because that's really important when you're talking about sometimes the barriers to getting help, and one of those things is dignity, pride, and fear of disclosure. Because of those repercussions, it's so important that you get that first experience right.
Correct.
Because that can really determine whether or not a person continues to engage in help that's needed.
That's correct. That's exactly right. And so I trust that we've got a fantastic team of professionals who have always do provide dignity and respect, and it's a free service as well. So we've tried to break down all the barriers to getting help.
No, it's amazing work what you guys do, and I really hope, we touched on it a little bit, but looking at more from a national and a global perspective, I don't think things like nursing, they're not intrinsic of settings, are they? So, if you go to, another country, it's not like you're going to get different kind of care from a nurse.
No, the fundamentals are there, I think. And I think
that was the word I was looking for.
DNA, it's in our DNA. Nurses have got this, and midwives, and it's not just that, it's teachers, it's paramedics, it's doctors. It's in our DNA, and I think that we need to whilst we need to do that, we need to give and care, we also have to look at ourselves and ensure that we don't overgive and overcare to the point of the exclusion of our own health and well-being, because that's what we see all too often, unfortunately.
That's right, and the human condition can only manage so much. And I was speaking to somebody yesterday, and they're in the caring profession, and they were saying, well, I put myself always second to the needs of others. And I said, why do you do that? And he said, well, that's the way it is. I said, how do you feel about, compromising your own, well-being and health that could therefore compromise somebody else's if you're not, fully agile and fully present? Because we know that can end in some pretty devastating outcomes if you're not taking care of yourself.
Indeed. And sometimes that's the trigger point for someone to ask for help. They've at a point where they completely disregard their own safety or their own welfare, but they've had this moment where they've recognised, hey, I could actually hurt somebody here.
Yes.
And that's been the thing that's got them to pick the phone up. So we're not really concerned about what makes you pick the phone up or gets you to pick the phone up, as long as you pick the phone up, if that's where you're at the time. Yeah,
well, and I know it's an oldie but a goodie, I heard you say it once and saw it written somewhere as well about that oxygen mask analogy. You've got to put yours on first to enable you to fit somebody else's.
That's right, and we have to be at our best to be able to do the best.
So what would you say to anyone right now who's either thinking about getting into the profession or is already in the profession, and they could help them manage their own expectations better? What would you say?
If they're thinking about getting into the profession, is to do your homework and to find out...
Oh, that's so boring, Glenn. Homework? Straight off. Everyone's gone to sleep and turned off their radio.
Shop around.
Due diligence.
Ask a few questions. Find out. Everyone knows a nurse, or at least someone who knows a nurse.
Get yourself into hospital, feign appendicitis. Get yourself in there and work out what you don't like.
Well, that's the thing. I mean, we're a consumer organisation. We're a consumer society, and the hospitals and health services need graduate nurses. They need us. So it's important that if we can find out what we're up against, and that's the first thing. I think it's a fantastic career.
Is there a shortage of nurses?
Well, no, there's not.
Okay.
As far as I understand, there's graduates who are coming out who aren't able to fit into or be successful in the graduate intakes. But so as I understand, no. But I think that in order to be best prepared for it, it's really important to know what you're in for, and to know that there's social impact, in terms of your life with your family and friends because of the work hours and things like that. So that's important to know, but to also really just ensure that you don't have massively high expectations of what you're going to be able to do, and to limit the expectations and for them to be realistic, because none of us is perfect. And we all fall over sometimes, and particularly when we're learning, and we're learning new things all the time, which is what novice practitioners are doing. They're learning all the time, and that's potentially when you can become undone if you're not looking after yourself.
Oh, absolutely. Finally, what do you think makes a good nurse?
Compassion, an ability to sort of reflect and understand and be empathetic, to listen.
Like really listen with everything.
Yeah. And look, this is, we're talking in an ideal world, so this doesn't necessarily always happen all the time, but as long as it happens most of the time, I think that's a pretty good standard, a pretty good outcome.
Yeah, and managing expectations. I talk about it all the time, and sometimes that can be to say to the person who's in your care, I'm not travelling great today. This is what you can expect from me. I've got some additional backup for you, but whilst I'm with you, you've got 110% of me. But we can let people know what's going on for us.
Yeah, look, I would probably have that conversation with my colleague and say, I'm struggling a little bit. I did a late last night. I'm back here this morning. I'm a little bit tired or something. Rather than expose myself to the individual that you're caring for, even though theoretically it's a human thing to do. But in terms of ensuring that they've got the utmost confidence in you, I'd probably stay away from that disclosure to them. But I don't mean to push it a bit, but I wonder why that has to be. As long as you're exercising duty of care, to be able to say I have a solution. Yeah.
But the reason I'm just about to walk away from you and leave you for the rest of the day, because sometimes, I've been in hospital before where somebody's caring for you, then all of a sudden they're not there.
Yeah, that's
and you go,
right.
well, where did that person go?
Yeah, and that's communication. That's one of the things, and the answer to your question, the communication, and that's one of the really vital things.
Yes.
Is the ability to communicate with your care receivers or the people that you're looking after, but also the people you're working alongside, because we see the results of poor communication quite regularly, and they're always, or not always, but they're quite often avoidable.
Definitely. But getting away from this extreme political correctness, which really shuts us down and limits how far we can go with being authentic, I think that's something to question. And speaking of authentic conversations, next week on the show, I have one Jackie Louise Lambie. You might remember Jackie as being an Australian politician, and she's quite contentious. I love what Jackie has to say, but, kind of similar to today, we're going to be talking about military and mental health in the military, because it's something that's very, very dear to Jackie's heart and also to mine and many people as well. So let's hear what she has to say. So now, Glenn, some things that we spoke about today could bring up feelings for people that are quite uncomfortable. If you're a nurse or a midwife, you can call what number again?
So our number is 9415 7551, or our website is nmhp.org.au. And you can just give us a call. We're business hours, office hours, and there's also a national telehealth service, and it's called Nurse and Midwife Support. So that's 24/7 telephone support, and they've got a great website too.
Yeah.
So that's all around
and
the
if you
country.
needed to be held just a little bit tighter for a little bit longer, don't forget, Lifeline is 131114. Suicide callback service 1300 659 467. Of course, 000 is not a hard one to remember. Take care, everyone. We'll see you next week.